Hey folks, we're here with Tom today. We're going to be talking about hip hinging. Alright, hip hinging is the first step to squatting. So you may experience knee pain if you squat, and that's maybe why you don't squat. Well, I want you to learn how to hip hinge first so that you can squat, because squatting is good for you. So some of the limitations that we can have are in the ankles, as far as the range of motion in dorsiflexion and plantar flexion. And then in the hip, you can be really tight up there. Your thoracic spine can be really tight. You couldn't maintain a nice neutral spine. There's a lot of different things that you could do a little peanutting for to help. But here's a little repatterning thing. So we're going to leave the peanut out for tonight. All right, Tom, I want you to cut yourself in half in a slow motion, just kind of like that. And I really try to pinch those hands. Okay. Okay. So as you can see right about there, he's starting to lose and he's starting to fall here. Right, now he's trying to drive his knees forward to compensate that way. Different things that he's doing here. It's a combination of tightnesses. So what we can do to kind of repattern that is just continually to chop yourself and learn how to hip hinge and let the knees follow and the ankles go at the same time. And then the next thing you can do is learn how to kettlebell swing. Now Tom, all I want you to do is like a pendulum. Just let it kind of, you relax, let it fall through, stand up. I don't want you to be tight here. Alright, these are just wet noodles, just hold on to the kettlebell. Alright, and do that same thing. Hip hinge, let it just swing back and forth. Alright, now stand up, right? There you go. Now just relax. You look a little tense here, just relax. There we go. So as you can see, the further back his butt goes, he's starting to actually squat correctly. He's getting that squatting pattern. So this is something that is going to help you in all performances, even tying your shoe, picking up a pen that you dropped on the floor. Make you relax, Tom. So give it a shot, folks, and learn how to hip hinge, but also make sure you're doing all that peanutting. So
where should I peanut?
I would say right around all these ankles here. I'm going to just leave muscle groups out. I'm going to say around the ankles. I'm going to say high hamstring, all your glutes. All right, you can hit the quads here, the high quads, the hip flexors.
All right.
Definitely your thoracic spine, which is part of that daily habit challenge.
Would it be the same pressure in these areas? Would it be a combination of both?
If you're going to do it and then go into squatting, you would want to just kind of bring yourself to a range of motion. Go a little bit slower and just kind of get long through different joints as you're on that spot with the peanut.
Right.
But, afterwards or on an off day to make yourself a little bit more, taking a bigger step in that tissue work, you could go nice and slow, sustained pressure, get deep. Don't shut down that central nervous system before you work out, but definitely do it on the off days.
Okay. Makes sense. Thank you.
All right. Be well, folks.
Namaste.